Hi YouTube, my name is Kevin. I'm a longtime sufferer of psoriasis, 40 years, and also a longtime sufferer of psoriatic arthritis, which I've had for about 15 years. But I've also been on Enbrel for the last 12 years, and that is the purpose for this video. I want to share my experience with Enbrel, being a longtime user. I know that there are people out there who are thinking about going on Enbrel or other biologics. I can't speak to the other ones, but I have been on Enbrel without a break for 12 years, and I just want to share my experience so that it may help you to make a decision if you're thinking about going on the drug. I first started to show symptoms of psoriasis when I was 9. And it's just, came in, as for many people, it came around my elbows and knees. And then as I grew older, it spread over more and more of my body. At one point, I had very large lesions on my shins, and it was all over my torso, just little patches pretty much everywhere. I had a giant lesion on the back of my head, which I had hair at the time, but exhibited itself to other people as very bad dandruff. But that just was part of who I was, and I dealt with it. Used the typical topical treatments and shampoos and the things that people do to get by when they have psoriasis. As I always like to say, you have to have a thick skin if you're going to have psoriasis, or you develop a thick skin if you're going to have psoriasis. If somebody didn't like me because of that, so be it. They weren't a person of substance anyway. However, when I was in my early 30s, early to mid 30s, I started to what started with kind of a numb sensation in the top of my right foot, which then went down to my toes in my right foot. My left foot started getting to my fingers, and the toes started swelling. And I went to the doctor, and it was diagnosed as psoriatic arthritis. So something I think between 10 and 20% of the people that have psoriasis end up with psoriatic arthritis. And it exhibits a lot of the symptoms of rheumatoid arthritis. So over the next year or two after the symptoms first emerged, it became increasingly difficult to even walk to work in the morning, and I was starting to think about some fairly extreme measures to try to relieve the discomfort that I was feeling. I had been going to a dermatologist for a long time, and the dermatologist let me know that that Enbrel had recently been approved for use on psoriasis, and it had been approved for some time for use on rheumatoid arthritis, and was starting to be used for as well for psoriasis and psoriatic arthritis. So he offered to put me on the drug. That was in February of 2003, and I took him up on it. And I'll say that the initial experience was fairly rapid. And I know everybody's different, and I can't promise that it's going to work that way for you. But when I first started to take the drug, the relief was within weeks. I could see that my skin was improving. I could feel the pressure relieve in my joints, and particularly my feet and my hands. And then within probably 2 months, I had achieved, the place that I am now, even 12 years later. So it was, to me, bordering on miraculous. I had never hoped to get rid of the psoriasis. I'd only hoped for relief from the psoriatic arthritis. And, so the relief from the psoriasis was kind of a side benefit of the relief from the psoriatic arthritis. But it was dramatic and borderline miraculous. I take the drug and I have almost always taken the drug with the 25 milliliter injections twice a week. For a short period of time, when they started to offer it at 50 milliliters, the doctor moved me to the 50 milliliters. What I found was that towards the end of the 1 week period, so you take it once a week instead of twice a week with 50 milliliters, that I could really feel the psoriatic arthritis coming back, and I could see it coming back on my skin. And I see it much less so when I take the 2 injections a week. So I think it's because it keeps the level of the drug more even in your system. To me, that makes sense. All I know is that it works for me. I went back to the 25 milliliters twice a week, and I prefer that over the once a week 50 milliliter injection. I'm going to insert a video or a screenshot of the doctor's drawing of me before Enbrel, and you'll be able to see, how widespread that the psoriasis was, and I can only tell you about the feeling, the joint damage that I could feel, or the joint discomfort that I could feel in my feet and hands. I can tell you now that pretty much the only places I have psoriasis are, you can see just a very, very minor, untreated, by the way, I don't put any topicals on, lesion on my elbow and on this elbow, and similarly on my knees. I have it in the corner of my eye, right here. That it's very minor, but I'm aware of it. Occasionally I get like some skin that'll flake off there. I have it in my ears, which is annoying, but it doesn't affect me in any material way. And I've got it in some other soft tissue areas, and I'll leave it at that. But other than that, I don't have any on my torso. I have nothing on my legs, my upper legs, my lower legs, my back, or anything like that. So it's pretty limited to very small areas, whereas before the lesions were very large on my legs, and again, the back of my head was almost entirely covered. Lesions on my elbows were very large, as well as on my forearms, and all that is gone. So as a side note, I recently did have some trouble with my feet and my knees, separate issues. My feet, I started to have some pains in my toes. I went to the doctor, they did x-rays. They pretty much determined that the problems I was having with my feet were due to my shoes, that they needed to, I've got kind of flat feet, and they needed to create a kind of a stronger arch in the shoe, which once I did that, it kind of eliminated the problem. But in the process of assessing what the cause was, they took x-rays, and they confirmed this was only about a year ago, that after being on Enbrel for 11 years at the time, there was virtually no sign of damage in my toes due to arthritis. So I can talk about how I feel and that I'm able to do athletics and all these things, but that was a nice independent affirmation that the drug is actually not only making me feel better, but it's actually inhibiting the psoriatic arthritis from damaging my joints. I've had some trouble with my knees. Also, I was a little bit worried that was related to maybe decreasing efficacy of Enbrel. Turns out that I was an athlete almost all my life, and ran and played a little football, soccer, did all sorts of different sports, but that I have torn meniscus in both my knees, and but other than that, again, not very little sign of any kind of arthritis in the knee joints. And I went to some physical therapy, and within the span of about 6 months of good rigorous physical therapy and weights, I'm back active and competing at a high level for somebody who's 49 years old in sports. So I'm convinced that had I not been on Enbrel, that my athletic career would have been over in my mid-30s. And I can tell you today, again, I'm competing. I play a sport called hurling that is very fast and very rigorous and requires a lot of running, and I'm able to do that, and I'm out competing with people who are half my age or less. And I credit Enbrel 100% with allowing me to have a full life like I have. And stopping the what was the damage that psoriatic arthritis was causing before I got on the drug. So I could ramble on, but I just wanted to share this because there aren't a lot of people that have been on the drug as long as I have been. I got on it in February of 2003, and this video is being recorded on September 24th of 2015. So if you are thinking about or have been offered to take Enbrel as a way to address your psoriasis or your psoriatic arthritis, I wanted to share my experience. I would hope that you can overcome your fear about taking an injectable and at least give it a try. Again, I can't say whether it's going to work as well for you as it's worked for me, but it has worked really well for me. They've offered to give me other biologics or to move me onto a different biologic because some of them are a little bit cheaper, and my insurance covers some of the other ones a little bit better. But I have no intention of getting off of Enbrel. It's worked well for me for 12 years, and I don't want to take the chance of upsetting, whatever's going on or whatever it's doing inside of me. It's working, and I don't want to take any chance of upsetting that. So, again, I wish you the best of luck in your decision, and I wish you the best in your efforts to get well. If you have any questions, again, you can send me a text or write me below. You can also send me a video or contact me any means that you'd want to. If you have any specific questions, I'd be happy to answer them. I hope this is helpful to you, and again, good luck getting healthy. Bye for now.